Welcomes to at Hidden History Hub H. The world's biggest serial killer might never have been caught if he had known how to properly use a computer. Imagine a man who was not only committing serial killings, but was also a friend to his victims, a well-known personality in the city, and on top of that, a doctor. This is the astonishing story of Harold Shipman who used his clinic not to save lives, but to take them. In a small town called Hyde in England, he carried out serial killings right under everyone's nose for 23 years. Even after putting more than 250 people to death, no one suspected Dr. Shipman. And perhaps no one ever would have, if he had not made one small mistake. Why was he killing people? How did he avoid getting caught for so long? And what clue did the police find that exposed years of hidden murders in a single moment? How he chose his victims. Shipman mostly targeted elderly patients who lived alone, people whose deaths would not raise suspicion. He gave them extra time, visited them at home, listened to their problems, and made them feel cared for. Some trusted him so much that they even gave him the keys to their homes. Because of this caring behavior, he became very popular in Hyde. People believed he had a special gift for treating elderly patients. But behind this kindness, he was secretly gathering information: who lived alone, who had money or property, who visited them, and where their relatives lived. Once he was satisfied, he would give the patient a fatal overdose of medication. Since most victims were over 80 years old, their deaths did not appear suspicious. This continued for years, until he made a mistake. Early career and drug addiction. Shipman began his career in Pontefract, about 70 km from Hyde. In 1974, he moved to Todmorden, where he worked as a general practitioner at the Abraham Ormerod Medical Center. During this time, he overprescribed a strong painkiller called pethidine. It is a legitimate medication, but highly addictive. Shipman himself became addicted to it. He would prescribe it to patients even when they did not need it. Patients felt good after taking it, not realizing they were being given a narcotic. This made them more attached to him. Eventually, hospital administration discovered his drug abuse. He was dismissed, and his medical license was nearly canceled. However, after spending some time in rehab, he managed to keep his license. In 1977, he moved to Hyde and joined the Donnybrook Medical Center as a general practitioner. By 1993, after opening his own clinic, the frequency of murders increased significantly. Suspicion arises. In March 1998, Dr. Linda Reynolds, who worked at a nearby clinic called Brooke Surgery, noticed something unusual. In just 3 months, 16 of Shipman's patients had died. Meanwhile, Brooke Surgery, having 3 times more patients, had only 14 deaths during the same period. Suspicion grew further when it was discovered that all 16 of Shipman's deceased patients had been cremated rather than buried. Most Christians prefer burial, so this pattern seemed strange. Dr. Reynolds submitted a report to the Manchester coroner, highlighting that most of the deceased were elderly women found dead at home, often with Shipman being the last person to see them alive. Many were found sitting fully dressed, which seemed unusual. An investigation was launched, but due to lack of solid evidence, it was closed after a month. Manipulating death certificates. When Shipman's patients died, he signed Form B, stating the cause of death, usually old age. Form C, which required a second doctor's signature, was often signed by colleagues who trusted him. By falsifying death certificates and encouraging cremation, he ensured that evidence was destroyed. Many deaths went uninvestigated. The mistake that caught him. His final victim was 81-year-old former mayor Kathleen Grundy who died on June 24, 1998. Shipman was the last person to see her alive and listed old age as the cause of death. Her daughter, Angela Woodruff a lawyer, became suspicious after discovering a will leaving her mother's house to Shipman. The will mentioned only one property, although her mother owned two, suggesting the writer was unaware of the second house. Police exhumed Kathleen Grundy's body. The autopsy revealed high levels of diamorphine, medical heroin. When questioned, Shipman claimed she was addicted to heroin and said he had recorded this in her medical notes. However, he had recently started using computerized records. Although he backdated the entry, the system automatically recorded the last edit date, which showed it had been altered after her death. Police also found the typewriter used to create the fake will. Some letters were defective, and the same defects appeared in the forged will. On September 7, 1998, Harold Shipman was arrested. The full investigation. After his arrest, more families came forward. Investigators found a clear pattern. Lethal diamorphine injections. Shipman signing death certificates himself. Cause of death listed as old age. Encouraging cremation to destroy evidence. A detailed inquiry later concluded that he had murdered at least 218 patients between 1975 and 1998. Some estimates suggest the number could be as high as 260 or even 508, according to claims made by a fellow prisoner. Conviction and death. Shipman was convicted of 15 murders and sentenced to life imprisonment. In 2004, he committed suicide in his prison cell by hanging himself with bedsheets. The true motive behind his crimes remains unclear. Some believe he was a psychopath. Others think financial gain played a role. Another theory suggests that witnessing his mother's death from cancer, while she was receiving morphine for pain, may have psychologically influenced him. To this day, Harold Shipman is considered one of the most prolific serial killers in modern history.